Good morning, everyone. I am Dr. Reena Gupta, Senior Consultant at Baby Science IVF Clinics, Delhi. So, in this live session, I will be talking about what are the common causes of infertility and what is the IVF process. Now, when coming to the causes of infertility in female, generally, whenever we talk about infertility, it is first we start evaluating female, but as such, we should treat it as a couple. But in female, the common causes of infertility which is seen is first is if the tubes, that is the fallopian tubes, which is an important structure where the egg pickup occurs and where the fertilization happens in the initial part of embryo formation process. So that is called the fallopian tube. So if the tube is blocked or it is not functional or it has been removed because of some reason that there was a pregnancy in the tube, so in that case, that side of the tube, or if both the sides of the tubes are involved, then the patient will not be able to conceive naturally. Sometimes the tubes look patent to us on the test, but they are not functional. So that can also be a reason that the patient is not able to conceive. So this is one of the most common causes of infertility for females. Second common cause is ovulatory problems. That means in ovulatory problems also there are two types. One is that the commonest endocrine disorder, that is polycystic ovarian disease. So sometimes women has many eggs in their body and but these eggs do not mature on their own. So this is called as polycystic ovarian pattern. So in these cases, they need some assistance, some medications or injections so that the eggs start maturing. And once the eggs start maturing and other things are normal, then the patient can conceive easily. It is easily treatable. The second ovulatory problem is diminished ovarian reserve, or if the number of eggs are less in a woman, or the number of eggs are she has absent number of eggs, that is called as menopause. So to understand this, every woman is born with a fixed number of eggs, and it is not like that every woman has this number of eggs. Everyone has a different number of eggs, and this is since the birth. And after birth, every month the number of eggs keep on decreasing. Okay, so if a woman is born with a good number of eggs, she will have good number of eggs even after the age of 30. But if a woman is born with less number of eggs, then her eggs will keep on declining, and by the age of 30 she may or may not have any eggs. So this is called as diminished ovarian reserve. So if the number of eggs are very less, or if the patient attains menopause, that is the no eggs are left, then she is not able to conceive. Sometimes with the help of injections and IVF, when there are less number of eggs, we can help them to conceive. And sometimes if they attain menopause early, then we may have to give them IVF with donor eggs. So these are the two common ovulatory problems in the woman because of which they are not able to conceive. There is one more which is hypothalamic hypopituitary dysfunction. In that, it is easily treatable. You have to give injections and form the eggs, and the patient can get pregnant with the help of those people. So these were the two problems, tubal and ovulatory. The other reasons can be endometriosis. So endometriosis is a problem where the blood, the menstrual blood, it gets collected in different parts of the pelvis, and which can lead to cyst in the ovaries. It can lead to adhesions in the pelvis. It can so that the tubes get blocked, or there may be fluid in the tubes. So if there is severe endometriosis, or in fact moderate endometriosis, the patient may have difficulty in conceiving. The reason being the tubes may not be functional. The reason being the eggs may not be able to come out of the ovaries. That means the eggs do not rupture, so the patient is not able to conceive. Or maybe the quality of eggs is affected because of the disease. And sometimes With endometriosis, there is adenomyosis in the uterus, which leads to decreased chances of implantation. The next causes which are not that common is fibroids. If the fibroids are coming in the cavity of the uterus, we can remove them surgically and the patient can conceive easily. The other can be polyp in the fibroid that can also be removed hysteroscopically and it is easily treatable. If there is other thing is that the uterus is abnormal in shape. So sometimes there are two uterus or there is a septum in the uterus. For septum, there is a surgery available. If there are two uterus, then we have to go with it, and the surgery is not advisable in such cases. So these are the known causes of female infertility. Then in 30-40%, there will be reasons where we don't find any cause, and it can be because of the poor quality of eggs, or it can be unexplained, which we will not come to know. Now coming to the male causes. So for male partner, the evaluation is very easy. We just have to test the semen analysis. And in the semen analysis, we look for three things. One is the count, sperm count. Second is the motility of the sperms. Third, whether they look normal or not. So if the count is less than 15 million, it is abnormal. If the motility is less than, progressive motility is less than 32%, then it is abnormal. And if the morphology is less than 4%, then it is abnormal. So there are few causes which can be treatable, and there are few causes in male for which there is no reason and which cannot be treated. So the causes could be that one is that the count of the sperm is less. If it is borderline less, that is 10 to 15 million, we can give them some medicines to improve the count. But if it is very less, that is less than 10 million, sometimes it is associated with decreased motility and morphology also. These patients will need treatment and ultimately IVF. So this is about decreased count and motility. Second thing is, and mostly we don't find any reason why this is happening. The known reasons could be lifestyle reasons, that the patient may be obese or there is smoking, alcohol. All these things affect your sperm count. Excessive use of electronics. So if you are keeping your laptops, your mobile phone near your private parts, then it can affect your sperm formation. So all these are lifestyle factors. The other thing can be varicocele. In varicocele, there is the veins are dilated in the testes, and which leads to the increased temperature in the testes and decreased sperm production. So that can be a known reason for the decreased or absent sperm count. The other reason could be some infection in the past. Sometimes, genital infection, there are no symptoms, especially in men, and it can affect your sperm count. So these are the known reasons. Sometimes other than these, there can be hormonal causes, that there is a lesion in the pituitary, or there is hyperprolactinemia, or there are thyroid disorders. They can also affect your sperm counts. So these are the reasons why the sperm counts or motility can be low. Second thing is, sometimes there are no sperms found in the ejaculate, that is known as azoospermia. So in azoospermia, there are two types. One is obstructive, the other one is non-obstructive. If it is obstructive azoospermia, that means the sperm production is there in the testes, but the sperms are not able to come out in the ejaculate. In those cases, we will find the sperms in testicular biopsy, and sometimes it can be corrected surgically also, and the sperms can come in the ejaculate, but the success rate of surgery is very less as compared to IVF. Second is non-obstructive azoospermia. That means there is testicular damage and the sperm production is very less. It is testicular injury. It could be because of varicocele. It could be because of trauma to the testes. It could be because of any surgery in the past, like hernia or appendix. Or it could be because of infection in the childhood, like mumps. So if there is non-obstructive azoospermia, that means there is testicular injury. Then there are no treatments available, that medicines and all that the sperm production will increase. The only thing available is testicular biopsy. There may be some parts in the testes where the sperm production is still there, and we can use those sperm to give you a biological child by doing ICSI. The other problem in the male partner could be sexual dysfunction. So there may be erectile problems. That means there may be erectile dysfunction because some most common reason is anxiety or diabetes, or if the patient is on antipsychotics or antidepressants, then these things can lead to erectile dysfunction. The other thing is retrograde ejaculation, where the sperms are not coming in the ejaculate, but they are going into the urinary bladder. So for that, there are treatments available, and the patient can conceive. So these are the known causes of infertility in male partner and female partner. Grossly, there are few causes which we also don't know. So sometimes when we do IVF and we take out the gametes, then we come to know that there is a problem in the quality of eggs or in the sperm. Sometimes, the sperms have an abnormal morphology, that is, their head is not formed, that is not known as globozoospermia. There is no treatment available for it. So all these things we come to know in IVF lab. So these are the causes. Now I will talk about the IVF process in very short. So when we are doing IVF, first thing is why we are doing IVF. So there are direct indications of IVF. In the direct indications, it is if both the tubes are blocked, then the patient cannot conceive naturally, then they need IVF. Second, if there is a severe male factor, that means if there is, as I told you, if there is severe decrease in the count of the sperms, or the motility, sperms are immotile, all the sperms are immotile, or if we find the sperm in the testicular biopsy in cases of azoospermia, then these patients will need ICSI. And here I want to emphasize one thing, that if it is testicular injury, that means if the counts are very low, less than 5 million, motility is very less, then it is sometimes a progressive feature. That means you are able to find sperms now, but maybe after 3 to 6 months, we will not find these many sperms also. And since it is testicular injury, then the patient may not be able to get pregnant through their own sperms. So it is better to go for IVF ICSI at that point only, rather than wasting time in taking treatments. Or if you are not ready for the treatment at that time, that is IVF, then you can at least freeze your sperms at that time, so that later on, if there are no sperms in your ejaculate, you can have your own biological child. The third indication for IVF is if there is severe endometriosis. In severe endometriosis, stage 3, 4, directly IVF is indicated. Now the next indication would be if somebody wants to preserve their fertility, that means fertility preservation. It is a new thing nowadays, where it can be for medical reasons or social reasons. The medical reason could be like the someone is going through treatment for cancer, and when somebody is taking cancer treatment, so chemotherapy and radiotherapy is given, and generally these drugs, they affect your gametes. So whether it's a male partner or the female partner, or if they're not even married at that time and they are taking cancer treatment, they are generally advised to go for their fertility preservation. For women, we have to take out their eggs and freeze the eggs. And in case after their cancer treatment, there are no eggs left in the body, they can use those eggs later on to complete their family. Second reason is social reason. That means the patient is right now, it is mainly for females, that they are right now not ready for pregnancy. The reason could be that they are more career oriented, or they have not found the right partner with whom they want to spend their life. So, and they are more than 30, 35 years, then they can freeze their eggs, and later on, whenever they are ready for pregnancy, they can use their eggs so that they can have their own child. The last indication for IVF is sometimes, as I said, there are ovarian factors, especially if the number of eggs are less or there are no eggs, that is menopause. So in case there is menopause or there are no eggs left in the body, then you need donor eggs. Or if you have had previous IVF cycles but the quality of eggs was not good, then you need donor eggs. Or you have some genetic problem which can be passed on to your child, then you need uh, donor eggs. So that is one part of third party reproduction, that you need donor eggs. Second is if there is azoospermia and we don't find sperms in the testicular biopsy also, then you may need donor sperm. So that is also comes under third party reproduction. Or if the male partner has some disorder, genetic disorder which can be passed on to the child, they may not want that disorder to be continued in their family, then they can opt for third party reproduction and a donor sperms. So these are the main indications for IVF. So now these are the first we I talked about the causes and now the indications for IVF. Now we've decided that the other indications, here the other indications of IVF would be like patient has taken all kind of treatment and still they are not able to conceive. And at the end, after the age of 32, 35, the patient would need IVF. So now we decided if that the patient will need IVF treatment. So we will do some, preliminary test to see that the process would be successful. Right? So in those preliminary tests for male partner, it is the semen analysis and the routine blood test. And for female partner, it will be a transvaginal scan to see the number of eggs, to see the uterus, whether the uterus is normal for conception or not, there is no polyp, no fibroid, and to see whether the patient needs any kind of surgery like for hydrosalpinx or all that. And then there will be some hormone tests like AMH to detect the ovarian reserve, TSH, prolactin, and the routine tests for anesthesia and IVF like viral markers and LFTK. So these tests will be done. Then when we decided to start the IVF process. So the IVF process generally starts from the second or third day of menstrual cycle. So what we do in IVF, we give you we give the female partner hormonal injections. These are gonadotropin hormones, and these are given so that instead of just forming one or two eggs, many eggs start forming. So it doesn't mean that it will create eggs in your body. It will start increasing the size of the eggs which are there in your ovaries in that particular cycle. So when we do an ultrasound, we can see that there are how many eggs can be seen in that cycle on ultrasound in both the ovaries. So these injections will start increasing the size of all those eggs, or 80 to 90% of those eggs. So that is the aim of giving these injections. And why we want more eggs? Because if the number of eggs are more, the chances of having more embryos is there, and if the number of embryos are more, the chances of pregnancy and the chances of attempts you can take in one cycle is more. So that's the reason why we give these hormonal injections. So these hormonal injections are given for 8 to 12 days depending on how your body will respond to those injections, and the dose of injections is also decided by the fertility specialist depending on what is your ovarian reserve, what is your weight, and all that. So in between these 9 to 8 to 12 days, there will be transvaginal scans to see how your body is responding to the injections. When your follicles are ready, that means they are around 17, 18 mm in diameter, then a final trigger injection is given. This trigger injection is given for the final maturity of your eggs. It is not given so that the eggs come out of your ovaries, because in IVF we don't want your follicles to rupture. Before they rupture, we take them out. So this is given for the final maturity of your eggs. And after 34 to 36 hours of the trigger injection, egg retrieval procedure is done. So many people have this myth in their mind that the egg retrieval process is very painful. So here I want to clear that it is not at all a painful procedure, because it is done under anesthesia. It is done vaginally. There is no cut on your body. and it is done through the same TVS ultrasound probe, and there is a needle attached to it which is attached to the suction machine. So under anesthesia, we put the needle in your ovaries, we aspirate the follicles and give it to the embryologist in the lab. The whole process is for 15-20 minutes. And since it is done under anesthesia and there is no cut on your body, it is a painless procedure. And it's a daycare procedure. You will be discharged 3 to 4 hours after the egg retrieval process. Now, once the eggs are retrieved, your uh, partner semen sample is taken, and then we see the gametes in the lab. The embryologist will see how many of those eggs are good, that means mature, which of the sperms are good. They will select the sperms for ICSI, and then we in our lab is doing ICSI for all cases because it has a better fertilization rate. What is ICSI is that we select the sperms, we select the eggs, and then we directly inject one mature sperm in one mature egg. So this is called as ICSI. So then the ICSI is done on the same day, and after that we culture the embryos for 3 to 5 days in the lab. Now the some clinics are transferring the embryos on day 3. Some clinics are transferring the embryos on day 5. Now here in baby science, we are mostly doing blastocyst transfer, that is day 5 embryo transfer, because it has a higher success rate as compared to day 3 transfer. The success rate of day 3 embryos is around 30-40%, and the success rate of day 5 embryo transfer is around 60-70%. So that's why we culture the embryos till day 5. And depending on the hormone values in the same cycle or on your endometrial lining, we can transfer in the same cycle or we can freeze the embryo. That will be decided on patient to patient. And we transfer 2 embryos maximum at a time, not more than that. Because if we transfer more than 2 embryos, there are chances of triplet pregnancy, which generally doesn't continue after 6-7 months. So to be on a safer side, we transfer 2 embryos at a time, and after embryo transfer, there will be medicines for 14 days and then a blood test to confirm that you got pregnant or not. So this is the whole process of IVF. If we do a fresh embryo transfer, the whole process will be over in 3 weeks. But if we decide to do a frozen embryo transfer, then there will be a 2 week period where there will be a stimulation and egg retrieval. After that, you are free and the embryo transfer will happen in the next month. From second day of period, you will be put on hormonal tablets for endometrial preparation. So again, you will need 3 weeks. So if it is done in a frozen cycle, so the total duration of IVF process will be 6 to 8 weeks. So this was in short about IVF. And now I would like to take the questions from the audience. If they have any queries, they can ask me. So the first question is, what are the most common causes of infertility in couples? This I've already discussed in my talk, but the common causes in females, as I said, is it can be tubal factor, that means the tubes are blocked, or it can be ovarian factor. For males, generally it is the low sperm count and motility, or zero sperm count. Second question is, what are some lifestyle factors that can impact fertility? Yes, the lifestyle will impact your fertility. So one thing is that to have a normal BMI. If you are obese or overweight, it will affect your fertility. So if you are obese and overweight, you should lose your weight. That will help in conceiving you naturally and also will help the treatment to give you better results if you are taking some tablets or if you are going for IUI or IVF. So it will improve the success rate of your treatment. Secondly, if you are overweight, if the woman is overweight, then the chances of miscarriage also becomes high and the chances of complications in pregnancy also becomes more. So to have a normal BMI is important. Second thing is, and how will you lose weight? So to lose weight, it is not just diet and it is not just exercise. Both the things should go hand in hand. So you have to control your diet also and simultaneously you have to work out also. And this has to be a consistent thing. It's not like that you did it for 2 months and then you lost some weight and then you stop it. Then again you will regain the weight and there is no point in doing that. So you should be doing activities that you can do consistently. So start doing activity which you like rather than someone suggested you that start doing gymming. If you don't like to go to gym, you do what you like. It can be dancing, it can be swimming. So choose an activity which will burn your calories, but simultaneously you should also like that activity. The other lifestyle factors are smoking alcohol that can decrease the count of the eggs, that can decrease the quality of the eggs. For men, it can decrease the count and motility of the sperm, and also it can increase the DFI, that means DNA fragmentation index of the sperms. And if it is high, it can lead to infertility and sometimes increased miscarriage rate. So if you smoke and you drink alcohol frequently, then you should stop doing that. The other lifestyle is factor is that you should not have a very sedentary lifestyle. You should involve yourself in some kind of physical activity that keeps your blood circulation maintained, which so the blood to your genital organs is also blood flow to your genital organs is also good and your fertility is also good. So these are the changeable lifestyle thing factors which you can improve on and improve your fertility. uh, Next question is, what are the different steps involved in the IVF process? This I've already explained in detail, that first step is to it starts from the second or third day of periods, then there will be injections for 9 to 12 days depending on how your body responds. Then there will be a process of egg retrieval under anesthesia. After that, the process is done in the lab, that is creating embryos and culturing the embryos till day 5. And then your fertility specialist will decide, depending on your reports, whether they want to transfer in the same cycle or in the next cycle. So this is how IVF process goes. Now the important question is, what is the success rate of IVF treatment? See, we cannot give a blanket success rate to the IVF treatment, but because it depends on many factors. It depends on the age of the woman. It depends on the number of eggs in the woman. It depends on the semen parameters. It depends on how your uterus is. So, but generally, when we take out the data and statistically saying, in best of the IVF labs, the success rate, that is the pregnancy rate after first cycle of IVF, is around 60 to 70%. And the take home baby rate, that means after you got pregnant, you got a healthy child, is around 45-50%. But it will differ in patient to patient. So let's say if we are doing a self cycle in a patient who just has tubal blockage and she is young, less than 30, with an average to good ovarian reserve, then the success rate with 2 good embryos is around 70-75%. But similarly, if I am doing an IVF process for a patient who has a tubal block but she is 40 years, then the success rate is around 15 to 20%. It is because now she is overage and the egg quality of eggs will be poor. So this is how is the success rate of IVF treatment. It will differ from patient to patient, but on an average, it is around 60 to 65%. What are the potential risks and side effects of IVF? As such, there are no long-term side effects of IVF. During treatment, you may experience, some kind of water retention, bloating, that pain of injection. That's it, and that also goes off when we, stop those injections. So there is no, as such, no long-term, you know, side effect. And the risk involved, it's generally a risk free treatment. The only risk involved is when we are transferring two embryos, there is a risk of twin pregnancy, and twin pregnancy is generally considered a high risk pregnancy. So it's it's a very safe process as such. Next is the cost of IVF treatment. See, cost of IVF treatment also varies from patient to patient because it will depend on what kind of injections we are using in the IVF treatment, what kind of dose we are giving to the patient. So the injections are of different types, and the cost will go up if we are using the recombinant injections or if we are giving you the higher dose. So it will vary from patient to patient, but the minimum cost will be somewhere around 1.5 to 1.8 lakhs in Indian rupees, and the maximum it can be anything. If the patient fails in the first cycle, they may have to go for the second cycle. But and if the patient is going for a donor cycle, it can go up to 3 to 3.5 lakhs. And the different clinics may quote different cost for the treatment. So it may vary from patient to patient and clinic to clinic. The next is, are there any new or emerging IVF technologies that couples should be aware of? Yes, there are new technologies to increase the success rate of IVF. One is, as I said, that we in all our patients are doing blastocyst culture. It's a new technology, and not all the clinics are doing blastocyst transfer. But yes, culturing the embryos till blastocyst stage will increase the chances of you getting pregnant in the first attempt. That is the first thing. The other is if the patient has had failed IVF cycles or there is a history of recurrent miscarriage, or if the couple has some genetic problem, then all these things can be tackled by doing pre-implantation genetic testing, where we take out few cells from the embryos and test them genetically whether they are normal or not. This increases the success rate of IVF, and this is indicated in patients who in whom the age of the mother is more than 35 years, if they've had multiple failed IVF cycles, if there is a history of multiple miscarriages, or if there is some genetic problem in the couple which can be transferred to the child. So that is one. The other third thing is sometimes we do IVF but the patient do not get pregnant despite transferring good embryos. So it could be due to shifted window of implantation. For that, we have a test which is known as endometrial receptivity area test, which can tell us that what is the right time to transfer the embryos, and it will tell us the exact window of implantation. The next question is, what advice would you give to couples who are struggling to conceive? See, for the couples who are struggling to conceive, I would say that they should first consult a good fertility specialist, get themselves tested rather than being, just, being sad that we are not able to conceive and not doing anything, because fertility treatment depends on the age of the couple. If you come at a younger age, the chances of you getting pregnant is more as compared to when you come after the age of 35, 36. So when you are getting difficulties in conceiving, go to your fertility doctor, get yourself test, change your lifestyle, and follow the advice. Next is there is a couple says I was able to conceive in early days of my marriage, but then my periods would come after 42 days. Now I'm trying to conceive. The report shows that both the tubes are blocked. If both the tubes are blocked, in that case you need IVF only. There is no other option because if we try to open the tubes, sometimes it may not work, and then you waste time in those treatments, both time and money. Next is I'm 32 years. I have a baby 4 year old now. Now I want to conceive. Okay, we are trying but unable to conceive. My menstrual cycles are irregular. Sometimes it happens after 2 to 3 months. Okay, so if your menstrual cycles are irregular, you should get some tests done. If you are put on weight after first child, you should lose weight, and you should get tests done like thyroid, prolactin, and AMH. If they're all normal, then you will be put on some medication so that your egg is forming properly every month, and you may conceive with those treatments. If not, then you may need other tests like tubal testing and uh, other tests depending on how you respond to the treatment. Thank you. If you have any more questions, you can message us.